Thank you for your interest in the Rural Health Clinic program. You have accessed Part 3 of the 4-part session entitled Medicare Billing for Rural Health Clinics. This session, Billing for Non-RHC Services Performed in the RHC, is designed for individuals who may not be familiar with the Rural Health Clinic program. For additional information about the RHC program, please access Parts 1, 2, and 4 of Medicare Billing for Rural Health Clinics, as well as other focused educational rural health clinic webinars sponsored by the Wisconsin Office of Rural Health. Billing for non-RHC services performed in the RHC. What is considered to be non-RHC services? DME. If you have a separate DME license, you can issue things such as crutches, splints, things like that. If you do not have a DME license, these items cannot be billed for. They would be just routine supplies as part of your RHC visit. Ambulance services are not considered to be RHC services and are not included in the all-inclusive rate. Any type of diagnostic services, such as the technical component of x-rays, EKGs, and the technical component is the part where you are actually running the film. It is not the portion where the provider is interpreting the film. Another thing that is not considered an RHC service are lab tests. RHCs must perform 6 required lab tests. However, they are not billed as RHC services. Screening mammography. Oftentimes we're performing mammography in the clinic. These are always billed as non-RHC services. Prosthetic devices and any services that your providers, whether they be the MD or a mid-level, if they provide hospital patients services, they do their rounds in the hospital, these are considered to be non-RHC services. The exception is swing bed. Swing bed is the same as a nursing home. Therefore, when the providers visit the swing bed patients, that is billed as an RHC service. But otherwise, those hospital visits, ER visits, surgery, anything that they are doing in the hospital outside of the swing bed is considered a non-RHC service and should not be billed to Medicare under the RHC provider number. Some of the new services that are out there right now are chronic care management and telehealth services. Are these considered to be RHC services? Yes, they are. Both chronic care management and telehealth services can be billed under the RHC provider number. There are special billing regulations for that, and you should review the slides for that in the billing section. So I talked about the lab and lab services that have to be performed in the clinic. They must be furnished. The 6 basic labs are CLIA waived tests. The chemical examination of urine, hemoglobin, blood sugar, examination of a stool specimen, a pregnancy test, and a primary culturing for transmittal to a certified lab. All of these must be able to be furnished in the RHC. However, they should never be billed under the RHC provider number because it is a non-RHC service. Here's something from Medicare back in 2013 talking about the billing of lab services performed in an RHC. The one thing that is considered to be part of the visit is actually the venipuncture. The blood draw must be included with the RHC visit, with the actual running of the lab test, even if it is done within the four walls of the RHC, should be billed separately under a non-RHC provider number. So as this goes on, it talks about the different things that need to be excluded on the cost report, which is another series in the RHC webinar series. So here's a grid as to how to bill those services if you are an independent RHC or a provider-based RHC. There are two different billing methods. And how do you know if you are independent or provider-based? Provider-based is when they are an RHC that is on the cost report of the hospital that owns them. An independent RHC will not appear on a hospital cost report. So if you are unsure, check with your hospital reimbursement department, and they will be able to tell you. So, lab. As I said, excluding the draw, this is the CPT 36415. If you're an independent, you're going to bill that on a 1500 form. And if you are a provider-based, you would be billing that on a UB form. Radiology, that professional component, now as you can see, I say it may be billed with an encounter. It would be billed with an encounter if the read is done by your RHC provider and it is his patient. If a read is done by a non-RHC provider, they will bill the carrier. So that goes for the provider-based also. If it's read by the RHC provider for an RHC patient, then it is part of the encounter. Otherwise, if it is read by the hospitalist radiologist, then you would bill the carrier. Any other diagnostic or radiology technical component. So this is the technical, the actual performing of the diagnostic test would be billed in an independent to the Part B carrier on a 1500 and to a provider based on a UB. So again, it is just that actual performing of the diagnostic test, not the interpretation. Non-RHC professional services. So this is when the RHC providers may be doing their rounds with the inpatients. They may be called to the ER, or they may be doing other types of outpatient services, such as surgery, or they may be called in for some other service to help out with outpatient. All of these are considered to be non-RHC professional services and should be billed to a Part B carrier, an independent again on a 1500, and to a provider based on a UB. Now, if you are a provider based RHC and you are doing method 2 to a critical access hospital, the hospital must include those services, those diagnostic services for that day on their UB under the hospital number and send it to the fiscal intermediary. So this is, something to refer back to for non-RHC services. Remember, only those services performed by an RHC provider within the RHC or a skilled nursing facility, which does include swing bed, is considered to be RHC services. All diagnostics, including lab, radiology, mammo, are considered to be non-RHC services and should not be billed under the RHC Medicare provider number. Thank you again for your interest in the Rural Health Clinic program. You have participated in Part 3 of the 4-part session entitled Medicare Billing for Rural Health Clinics. For additional information about the RHC program, please access Parts 1, 2, and 4 of Medicare Billing for Rural Health Clinics, as well as other focused educational rural health clinic webinars sponsored by the Wisconsin Office of Rural Health.